Pharmacists were always called doc. I don't know if you like that or don't like that, but no. Okay. All right. Would you just give us some insight into how and why CVS Health has been at the forefront of addressing this national epidemic? As the largest pharmacy provider in the nation, CVS Health has a unique perspective on the complexity of this issue. So could you first talk broadly about how CVS is approaching this challenge?
Sure, thanks a lot. And I want to thank the New England Council for convening this important session today. Obviously, prescription drug abuse is a insidious disease that knows no boundaries, and I think collectively it's through efforts like this where we can expand awareness and collaboration that will ultimately defeat this. With respect to pharmacy and CVS Health in general, just by way of background, we operate about 7,900 stores in 48 different states, and we see about 5 million people a day coming in and out of our stores. So we're fairly uniquely positioned from a consumer access perspective, as well as obviously as part of the healthcare continuum in our provision of pharmaceutical care. So towards that end, there are really three key things that I'll just touch on fairly briefly today that we've been engaged in around this issue. The first is really driving education and awareness. And that really ends up being on three different dimensions. The first is within our professional practices team, which is comprised of our pharmacists and our pharmacy technicians. It's important that they are equipped with the most current understanding around the diversion trends in the community, the abuse trends, as well as the treatment options. Because again, we fill a lot of scripts each and every day, so we're uniquely positioned to not only advocate on behalf of the patient, but also intervene with the prescriber when necessary. And again, particularly with our pharmacists, big focus in and around the current trends on fraudulent scripts and script passing. That's a big part of this issue. You'd be surprised at the amount of folks that will try to pass a forged script for a narcotic. So again, just one of the many different challenges that the pharmacists face. Now, with respect to our patients and our partners, and for purposes of today's discussion, you think about CVS Health, not only are we a leading retail pharmacy, but we're also a leading prescription benefit management company. So we have relationships with very large health plans and employer groups across the nation, and that's created another unique educational opportunity and partnership for us. But there are really three key pieces that we really want to raise awareness around as it pertains to this type of drugs. At the end of the day, appropriate use. So, you have a need, you've got a script for a narcotic or for an opioid. It's imperative that you follow the doctor's directions. You don't take too much. You take it as prescribed, and if you're having issues or concerns, you call your prescriber or you talk to your pharmacist. The second key piece, which is really kind of, I think, enlightening for a lot of customers when we talk about this, is the need to keep these medications safe and secure in the home. A lot of the diversion that occurs in the community actually happens right outside of the medicine cabinets in people's homes. It could be a loved one with a problem or a teenager who's experimenting. It could be a caregiver in the case of elder care. So people really need to think differently about how we keep these medications in the home. You don't want to you wouldn't leave your checkbook lying out on a table for anybody to grab. You got to think differently about the way we store our medications. And then lastly, the key piece that we're educating on is really the need to responsibly dispose of any excess or unwanted medications. I myself, when I've got a history of kidney stones, and started as a teenager, and I know that, my own personal experience, I would go to the emergency room, they would give me some narcotic pain medication, would eventually pass the stone, and we would, keep whatever was left over on hand for the next attack, because it could be in the middle of the night, it could be anywhere, and that really is a bad practice. And that's something we're really trying to drive awareness to our patients on. These are not the types of medications you want to stockpile in the home for a rainy day. And at the end of the day, it's best to get them out of the house, safely disposed, so that they can't be abused or diverted from the home front. So the second key piece that we really are advocating for is the expanded use of naloxone, trying to get that into as many hands as possible. For those of you that are not familiar with it, or you've probably heard it under the name brand Narcan, it's an opioid reversal medication that is really quite amazing. When administered to somebody who has had an opioid overdose, the effects of the reversal can be amazing. It literally saves lives. The key is you've got to have it in the hands of, a likely first responder. So, if you think about what you've seen in your own states, in your own communities, a lot of police and EMS have these medications on hand. There's a big push across the public sector now to try to get them in the hands of loved ones or parents or friends of those who are struggling with this type of addiction. So we're proud to say that through our efforts in Rhode Island and in Massachusetts, these were really our first two test beds where we piloted being able to provide naloxone to members of the community under a standing order or a collaborative practice agreement with a physician. So what that effectively means is that you can come into the pharmacy without a prescription, and the pharmacy can supply you with naloxone under the standing order of a prescriber. And along with that, we'll train you on how to use the medication. So again, very supportive of expanding access to potential first responders. And then the third piece I'll just touch on very briefly is we've been very active in trying to promote increased access to safe and environmentally responsible drug disposal options. One program that we're particularly proud of is a donation program for law enforcement that we started about 1.5 years ago. Any law enforcement agency in the nation can apply to us on our website, and we will grant them a drug disposal unit. It's big, kind of looks like a mailbox, very rigid, secure, it's bolted into the ground, and it serves as a receptacle whereby members of the community can come into the law enforcement agency, drop off their unwanted drugs, and then the police will then dispose of them safely and effectively. To date, we've been asked and we've donated 420 receptacles across the nation, and as of last month, those receptacles have collected over 7 tons of unwanted and excess drugs from the community.
Thank you. I know the naloxone program was recently highlighted by a White House program. Another one that I understand that has been highlighted is the Pharmacy Teach program. Could you just tell us a little bit about that?
Sure. So Pharmacists Teach is a program that we've launched, and it targets high school, preteen and teenagers, because these are really some of our most at-risk, vulnerable folks in society. A lot of abuse begins at this age. The Partnership for Drug-Free Kids recently released a study, and they found that 1 in 4 high school teens have admitted to either experimenting or abusing a prescription medication. And when you look at the trends and you talk to the teens, there's this wide misnomer amongst that age group that prescription drugs are inherently safer to abuse than street drugs. And they could not be more wrong. So what we've done is we've created an outreach program whereby our pharmacists can go into the community, go into a high school class, and it's essentially a 35-minute program. We collaborated with the Partnership for Drug-Free Kids on the content. It's multimedia, it's delivered by the pharmacist, but we also use video testimonials of a lot of, it's about 3 or 4 individuals that have fought their way through addiction starting at a young age. They tell success stories, and they tell the unfortunate tales of loved ones that have passed because of this terrible disease. So we're hoping to make an impact by getting into the high schools with our pharmacists. Our goal this year is to conduct 2,500 of these outreach programs during this school year. And we launched the program about a week and a half ago. We've already have close to 100 done. So again, far reach into the communities across the nation. One other note here, for those of you that have teenagers or no teenagers, ask them about farm parties. PHARM. It's a very, very disturbing trend over the last 5 years where teenagers will literally grab a couple of tablets out of the home, they look for prescription meds. They don't know what they're looking for. It could be a high blood pressure med, it could be a medication for vertigo. They take them, they go to these parties, they put them in basically a jar or bowl, and along with alcohol, whatever else they have at the party, they experiment taking these tablets. So again, something, another good example of where open communication with your teenagers on these issues can really hopefully help avoid bad outcome.
Thank you, Tom. Dr. Dennis Dimitri,